Hi, good morning, everyone. We are putting the presentation right there. So I will start talking a little bit, introducing myself. I'm Laure. Do I go ahead? Okay. So good morning, everyone. I'm Laure. I'm regional technical leader for Bio-Techne in Latin America. I'd like firstly to thank the organization of Report for the invitation and also to our distributor here in the northeast of Brazil, Indus Lab, to make this happening for me to come here. Today we're gonna talk about Ella. Ella is our automated ELISA platform from Bio-Techne. But first, I will introduce you to Bio-Techne. For those who are not familiar with Bio-Techne, I will introduce this company to you. So we are an American company based in Minnesota. We started for over 45 years with R&D system that I guess most of you already know. Their R&D system is very famous for its ELISAs, antibodies, and proteins. But we have other brands too. So we are not just R&D systems. We have all of those other brands that you can see in this slide here, Novus, Tocris, ACD, and others one. We have more than a half million quality products with 500,000 citations, which with our users, and you probably know our reactives like Luminex, assays, antibodies, ELISAs, but we also have 7 analytical platforms, and today I'm gonna talk about one of them. So Ella is a benchtop automated ELISA platform. Unfortunately, I don't have it here today. But I have a cartridge. I would ask it's in that table there, if you can pass so people can see, everyone can see here. To this platform enables the analysis of detection biomarkers, right? So I'll show a quick movie for you, so to present Ella to you. Can you help me? No, it's not working. Okay, we will improvise. So Ella is this ELISA platform that can automate all the workflow to address challenges that we face when we analyze, we do immunoassays. So here I have listed some of those struggles that we have in the lab when we are analyzing, like variability across labs, variability between users, operators. Multiplex is complex, especially in immunoassays. Usually it has many steps. And of course you have precious samples and use too much sample. So we know that traditional immunoassays like ELISAs, Luminex assays, they are error prone because they have many manual steps. And each of these steps can introduce error. And it takes a long time for the results, for 4, 5 hours, even more. With Ella, we have a more simple workflow with 3 basic workflow. We prepare, dilute, and load our samples and wash buffer in the cartridge. We scan the cartridge, put in the instrument, and run. And we have results in around 90 minutes. Everything happens inside the cartridge. You can see the cartridge there. So inside the sample well, we have a microfluidic circuits with 4 parallel channels. that enable us to multiplex the ELISA. So we can multiplex up to 8 analytes for the same sample, and the results come in triplicates for each analyte, which reduces the use of the sample volume. So here, it's in this example here, you can see that each channel has one color. Each color is one analyte. In this example here is a simple plex cartridge with 4 analytes, 32 samples. And inside each channel, we have what we call glass nanoreactor or GNRs. And the ELISA happens in each of these GNRs. So the sandwich ELISA will happen in each of these one. That's why we can have triplicate results for each analyte of each samples in the cartridge. So ELA delivers superior precision. We see that when we run our assays that we can detect even low analytes in low abundance. We also see a day-to-day precision. So when we do this validation with one of our customers, the biopharma customers, and they analyzed the same cartridge for 10 days using 2 different levels of recombinant proteins, they saw a very high reproducibility with low CVs between the days and the samples analyzed. And besides all the simple workflow, we also have a built-in standard curve. So the user doesn't have to build a standard curve. The standard curve is built in our manufacturing during the manufacture of the cartridge. That's why it's so important to scan the barcode that comes with each of the cartridge that we use. The standard curve is called up, and the instrument, the software calibrates the samples based on this standard curve built-in, which reduces, of course, errors, because sometimes we make errors exactly when we are building the standard curve in our ELISA plate or Luminex plate. So he is showing to you some examples of this standard curve that the instrument does. And also, when we analyze it, we did a study between 3 sites, 11 users, 9 instruments. We observed that the instrument was able to show really highly reproducible data. And also, as we do for our quantikinase ELISA assays, we also keep those lots and analyze it. And in this study, we analyze 50 cartridge from different lots, and we see a higher consistent results from each lot, which is also very important when we are talking about analyzing of immunoassays. And also, ELA lets us to detect more. So when we compare to our ready-to-use ELISA, we can see that our simple plex, the ELA assays, have a broad dynamic range, which allows us to detect samples with low expression of those biomarkers. In this study with one of our customers, during a CLIA validation, together with him, and he kindly provided this data, he shows that when analyzed, for example, IL-6 from different patients with different diseases, comparing to healthy individuals, we can detect different expression of this cytokine, which reduces the retests of sample due to dilutions issues, right? With samples that express more and those who express less. So in summary, ELA gives you consistent results with the automation workflow with simple steps, no much interference of the user, just pipette, dilute, and put your samples in the cartridge as well as the wash buffers. Quick results in less than 90 minutes. and a large dynamic range, which reduces the retest with our precious samples. So those are the cartridge formats that we have. So we have the multiplex formats that we can multiplex up to 4 analytes in the same cartridge, up to 32 samples. The blue one, you can see you can multiplex up to 8 analytes. We have, of course, our singleplex to do flexibility and throughput. And we have a last one that you design your own, that you can, for those who want to develop their own assays on the cartridge. Today, we have more than 250 validated assays, a menu across 3 species. Human are the one that we have the most, but we have also for mouse and rat. And just yesterday, before I was turning my computer off, I saw that we launched a new panel for non-human primates. So we are increasing these assays, the menu of assays. So lastly, just to show you, give you a quick 3 examples of ELA in use, I brought some results here from paper published. This one is published, is a group from Cambridge, University of Cambridge, that they showed the GBS, the association of GBS infections with admission to NSAU of newborns, and they used the ELA to analyze the cytokine storm of those samples, really precious samples from Billy Concord serial samples, and they use a floor multi-analyte simpleplex cartridge to analyze those 4 cytokines to evaluate the cytokine storm in this newborn. Unfortunately, I don't have time to discuss about the results, but just to show you that ELA has been used in the field. Also, this paper from a group from Singapore analyzing the vaccination of the Bio-Techne Pfizer vaccines in children from 5 to 12 years old, and they used ELA to evaluate the secretion of interferon gamma and IL-2, as you well know, that to evaluate the response, the immune response due to the vaccination, and also a multiplex assay on those children, in those children too. And the last one, today is the last day, everyone is tired. So we have, this is the NFL evaluation. So neurofilament light chain is an important biomarker for neurodegenerative diseases. And this group evaluates the levels of NFL as a potential biomarker for neuronal damage in children infected with malaria. And I brought this example because they have a really interesting sentence in their paper that they evaluate. They tell us that to the new immunoassays technologies like ELA, with the increased sensitivity, they are able to quantify NFL in the blood, which opens door to easily incorporate quantification of biomarkers with non-invasive or less invasive sample, like, for example, in their case, they would analyze with CSF and blood is really easier, especially when we talk about children. So I'd like to thank you. I leave you with my cell phone, WhatsApp, and my email if you want to talk more about ELA and know more about the technologies that Bio-Techne has. And also, I invite you to take a quick look at our website. We have really good information there. So thank you very much for having me.
Do we have any questions? As you could see, this product, I am particularly interested, and we will have one in our lab, because as you know, Laure, we discussed about this. We have a large multinational protocol focused on biomarkers. in one aspect, we will have a large Luminex panel being run in the samples. But I think the next step is to, if that really shows promising results, we could manufacture, kits that could be run in real time at the sites. So the idea would be to have that equipment or similar technology at a point of care. And I think this product is interesting because it shows the capability to customize kits and run with all the standard curves and everything at the site with minimal workload to process the samples. So we will be testing in our routine this equipment very soon, and we will have our own results in report biospecimens.
Yeah, that's exactly the use. Even in other applications, they have this huge panel of immunoassays biomarkers, and then they use Ella like to narrow down the biomarkers. Yeah. So thank you again, and I'm always happy to help. So you have my email, and thank you very much.